This week, you will learn about machine learning techniques for predicting the effect of a treatment on individual patients. We will look at the setup of randomized controlled trials and how they can help us understand the causal effect of a treatment on a population. You will learn how to build and evaluate machine learning models to be able to estimate how much a patient will benefit from a treatment. In this lesson, you will learn about the setup of randomized controlled trials and how they can help us understand the causal effect of a treatment on a population.
Let's say a doctor is trying out a new treatment and wants to see how effective the treatment is going to be for reducing heart attack, and comes to you asking how you would determine how effective the treatment is. So you might suggest that the doctor try out the treatment on a group of patients and not use the treatment on another group of patients. The group of patients on which the doctor uses the treatment is called the treatment arm, and the group on which the doctor does not use the treatment is called the control. Now, rather than not give any treatment to those patients at all, you might give them a placebo, which is a fake treatment that seems like a real treatment, or the standard of care, which is how those patients would be treated usually. So now you would follow these patients for a year and see what fraction of the patients in either group get a heart attack. Let's say after 1 year, you find that 2% get a heart attack in the treatment group, while 5% of the patients in the control group get a heart attack. So we can now express the effect of the treatment. We'll first do so by expressing the absolute risk of a heart attack in the treatment and control groups. So in the treatment group, because 2% had a heart attack, the absolute risk is going to be 0.02. Similarly, in the control group, because 5% had a heart attack, the absolute risk is going to be 0.05. With these two absolute risks, you can quantify the difference in risks with and without the treatment arm as the difference between the absolute risks in the control and treatment arms. So we have 0.05 absolute risk in the control arm and 0.02 in the treatment. So we take 0.05 minus 0.02, which is going to be 0.03, which we call the absolute risk reduction of the treatment.